Well, thank you so much for your time. And I would start my presentation now. I'm a medical doctor from Pakistan with specialization in ophthalmology. I have working experience both in Pakistan and Saudi Arabia. And I think a little background by myself is that during my clinical practice, I observed that the spiritual element of care is something that has been lacking behind. And although Pakistan and Saudi Arabia both being countries which are both religious, but then I always felt that when we are taking care of patients is usually based on treatment, on diagnosis, on interventions, and not really knowing the patient as a whole person. So that was something that was always I felt that was missing. When I moved here to the Netherlands, COVID happened, and then because of COVID, also I think I would say that the ideology of holistic care came into view, and the importance of mental, physical, psychological health, all these dimensions of care were even more emphasized. So currently, I'm doing an MPA master's program at the FU University in International Public Health. And for my internship, I met my mentor, that is Dr. Wim Bradisma and Dr. Charlotte. And Dr. Wim, he has background in physical therapy, and Dr. Charlotte, she has a background in traditional medicine. So together, under their guidance, this is going to be my first research ever. So I'm still a young student for research in that aspect, and I'm looking forward to learning from all of you. So coming to the research topic, that is towards embracing holistic care. We have always known that religion and medicine, these are two social institutions which have had a dynamic relationship with each other over time. It was previously the religious scholars who were considered or playing a role of physicians as well. And both these institutions were working together up till the Middle Ages and the French Revolution. And one of the rabbi, that is Rabbi Jacobitz, also mentioned that religion and medicine have been aligned with each other in almost in every land among all people and almost throughout the entire course of the recorded human history. Dr. Levine, an epidemiologist, also mentioned that institutions of healing and care were actually birthed by religion. So up till the Renaissance period, both of these were together. But then during the era of the scientific evolution, a separation developed between religion and medicine, because the religious communities were opposing the scientific discoveries, and thus over time, religion was considered as a barrier to knowledge and progress. Medical professionals also thought that the role of religion was irrelevant and, in fact, had adverse effects on patients' health. So, medicine adopted a Cartesian approach towards care, where the human body was separated from mind. And the healing of the body was considered part of care from the medical professionals, and the soul was considered a domain of the church or the religious community. And I think that is something even now that we see in our lives, that was mentioned by the Howard West in 1986, that cure, not care, has become medicine's primary purpose, and physicians have become warriors engaged in combat with death. And this has even highlighted even more, I think, the concept of patient-centered care or holistic care. And this has been mentioned by Professor Christina Pulaski, who is a pioneer in integrating religion and spirituality in medical curriculum, that she mentioned that the need to bring the art of compassionate caregiving is even more so now in the medical curriculum. So based on all of this, I come to the contextual background, which is similar, that from natural remedies, then it was moved to the faith-based organizations, then again to the modern scientific therapy. And now as we see that we have been evolving over time, that now it is going back to nature and to spiritual interventions as well, as depicted in this brief history of medicine. First a root, then a prayer, then it comes to a potion and a pill and antibiotics, and now it's going back to the natural remedies and towards spiritual interventions. So the research question that is related to all of this contextual background is that what is the role and significance of religion and spirituality in the Dutch medical curriculum and medical practice to ensure a holistic Dutch healthcare system? So the sub questions which will be addressing these main research questions will be to determine the role of religion spirituality in medical education for general practitioners and nurses, to know what is the role in primary healthcare education, and to understand that what do the students expect and understand regarding religion and spirituality in context of holistic care or positive health care. The benefit of this research is to have a holistic approach towards patient care and not to treat the patient as a subject. It aims to capture the perspective of healthcare professionals, the medical doctors, nurses, in their daily clinical practice, interaction with them, and then also the role of health educators, so that we can guide the future generations to approach a more holistic approach towards patient care. It will also address the spiritual needs of the patient, how significant they are, what are the potential advantages, disadvantages, and challenges they see if such a course or a curriculum-based education is provided to them. And then finally, the implications of religion and spirituality on outcomes of health. So based on all these questions, I've developed a conceptual framework, but if to take a background of that conceptual framework, I think it comes from the biomedical model of health, where the interventions or the medical treatment is considered more important as compared to other dimensions of care, such as mental health, psychological health, and social influence on health. Whereas when we talk about patient-centered care or holistic care, then we come across two very important models, which are the biopsychosocial spiritual model of health, and also the positive health model by Mahmoud Huber. And I would like to, give this saying, which is very important, by Sir William Osler, that a good physician treats the disease, but a great physician treats the patient who has the disease. And this is also one of the things that I have been observing in my interviews with the medical doctors, how they perceive it. So the conceptual framework for this research is actually based on these two models. That is the model of individual health effects from religion and spirituality, and then the exploratory model for developing medical school curriculum for psychological, moral, and spiritual wellness. And I have combined these two models into this current model, which depicts on an individual level the role of religion and spirituality, how it connects with the health behaviors, with disease detection, treatment, with the social connections, with mental health, and how it affects the immune system and overall physical well-being. And then the second step is the professional integration. When we talk about it, what is the perception of doctors and nurses and healthcare providers, spiritual caregivers, how they perceive how important it is for religion and spirituality to be incorporated in their clinical practice. And then the third step is to understand the needs of the patients. What do they demand from their medical care provider? Is there a religiosity gap between the healthcare provider and the patient's expectations? And then on the third level is the institutional dynamics, or the structural level, where institution incorporate the care that is provided to the patients. And then they can discuss societal problems, global problems in relation to religion and spirituality, which includes concepts like euthanasia or abortion, use of contraception. What is perception in the religious and the spiritual background, and how the doctors and patients can link this in order to understand it better. So for this purpose, the research design or the methodology was based on a mixed method design. It is a sequential exploratory research in which first the quantitative element was done by the use of questionnaires. Each questionnaire had 15 questions, which were focusing on the three main domains of this research, which includes the importance of religion and spirituality in healthcare, the role in medical curriculum and education, and then the role in clinical practice. And these interviews were at the same time, these questionnaires were at the same time in parallel design, were followed with the qualitative interviews. And for this purpose, I've conducted 10 interviews with different stakeholders. And the sampling for this has been done at the FOMC, which was a purposes sampling in which the stakeholders were identified. These includes medical doctors, nurses, medical students, both from the bachelor's program as well as the master's program, and spiritual caregivers. And based on this methodology, the results will be in a form of a convergent parallel design in which both the quantitative and the qualitative parts of the research are performed independently. And in the end, I have to combine these research to give an overall interpretation of my research. So this is the demographics for the qualitative analysis. For questionnaires, I had 49 responses, of which majority were medical students. 36.7% were medical students from the bachelor's background, and 24 were from the master's program. 12 of them are from the nurses background. And also in the 24 others, which was mentioned here, these includes nurse practitioners and physician assistants. There is sadly 2% of medical doctors, which could actually spare time for this research. The key findings for the questionnaire is how important it is to address the patient's religion and spiritual needs to provide holistic care, in which it was strongly agreed upon by 37% that it is really important, and 51% also agreed that it is. So this quantitative analysis also gives us an idea that out of the 49 responses, majority of them think that there is a need for religion and spirituality to provide a holistic healthcare. The other key finding that was, does the current medical education pay sufficient attention to spiritual and religious healthcare? And it is observed that 65% said that it is insufficient, and the current medical curriculum does not cater to the knowledge which should be provided to the medical students in order for them to be able to give a religious and spiritual care to their patients. And 18% are unsure, and 16% mentioned that it is sufficient according to their perception. When we talk about the role of religion and spirituality and how much it emphasizes positively the patient's mental and physical health and well-being, then almost we see that 90% of the responses indicate that it has a positive influence, whereas only 10% think that it can, they neither agree or disagree. But there is no disagreement that it has a negative influence, or it does not have a positive influence. Then coming on to the negative part, when we talk about negative influence on psychological health, here I think it is important to mention the psychological health, because this is also something that I observed during my interviews, that both whenever the interviewer were talking about the negative aspect, then it was usually related to treatment compliance or towards psychological health. So according to the statistics, 42% agree that it can have a negative influence, and only 16%, or you can say 20%, they disagree that it can have a negative influence. Because the data analysis is not complete yet, I'm still in the process of the research. And so I would say that I have to correlate these quantitative preliminary results with my qualitative analysis, which is done through these 10 interviews with different stakeholders. But the discussion points, I think, for this research would be that there is a decreased influence of religion in the Europe, and the concept of spirituality, specifically if we talk about Netherlands, is a broad concept, but it is more accepted in the Dutch society. And patients have developed their own perception of spirituality, and the self-reflection is very important for healthcare providers as well, because during the interview also, many of all of the interviewees were were actually forced to self-reflect on their own spiritual and religious beliefs. So that is also a self-reflection on concepts like spirituality and how we can relate it to health, how it influences health, also on a healthcare professional level, and then in terms of patients as well. However, when we talk about the curriculum, I think throughout the interviews also, there was an observation that religion and spirituality are not topics which are actually taught to the medical students as a separate course, but they are incorporated within the ethics. So ethics is taught to the medical students at the FU over a period of a bachelor's program. And it is in various lectures, so it varies between 2 hours to 6 hours per year. And it is not necessarily that those ethical topics will include topics related to religion and spirituality. And during my interview, a master's student also mentioned that because it does not cover religion and spirituality, so now that they are seeing patients, they feel that they are not well equipped to actually talk to the patients on a broader aspect. So this identifies that there are knowledge gaps in the medical curriculum which need to be taken up. And I think these are all the preliminary results that are there, but I have to compile the final results, and I'll share with you whenever that's possible. Thank you so much for your time. And if there are any questions, I would like to have them.
Yes, thank you. I take the chance, because I chair the session, sorry. You're a student.
Yes.
And of course, theory is in most cases stronger than the transfer in the concrete situation. But the point is, you're in the classical trap of all empirical research. You said some persons have responded to my questionnaire. The critical point is who is not responding. It might be that those who said, I don't care for this topic, are not responding, and only those that, yes, it's a very important topic, I would like to respond to it, they're in. And most of them are, of course, students. And so the statistics you've run could be that's an overrepresentation of those who said this is such an important topic, and it might not be true for the whole students or the whole nurses and so on.
Yes, I agree. Yes, I agree that it cannot be a representative, or it is not something that can be generalized. So because the sample is very short, small.
Yes, because in several cases, the older, let's say the experienced nurses or the medical doctors would say, yes, theoretically, this topic is very important, but we have neither time, nor competences, nor courage, or whatsoever. And of course, the students will usually say, this is so important, this to include it, but later on they notice they have no chance to imply spiritual care.
Yeah,
and that's the problem.
Yeah, this was also one of the observations through my interviews with the nurses and the medical practitioners, that even if they think that the spirituality and religion are important aspects which should be included in the medical history taking, but either because they don't have time or it is not in the system, they do not follow it as such.
Yeah. Klaus Baumann would like to raise a question.
Yes, thank you very much. Do you understand me?
Yes.
Okay, thank you very much for your talk and your very interesting research.
Thank you.
I got a question on that issue you raised about the consequences or the healthiness of religion and spirituality. It is key finding 3.3, issue 8.
Mm-hmm.
I have it on the board here, but maybe, yes. The issue is formulate the religion and spirituality may positively influence. You see, I think it is very evident that there are not many people who would disagree, because you said it may positively influence.
Could be.
It could be. There may be cases. So I would say this is hard. It's an issue hard to contradict. Whereas in the next one, you say religious and spiritual experiences may have a negative influence.
Could be.
Could be too. Although, and here it is, you say here you switch not to religion and spirituality, but you switch to experiences. This is also interesting. So I have sort of a methodological question, if it is good to raise questions which are so open, that it is so open to different interpretations that usually everybody could say, well, if I consider this possibility, this could happen.
Yeah, I understand your point of view.
Well, it is very different, because I wondered what do you mean with spirituality and spirituality in the medical curriculum? I mean, does it mean just respect for one's religion, or does it mean that we should write down one's religion in the medical records, or does it go further? Should medical students know more about religions? Should they be taught about the backgrounds of different religions? So if you want to ask that question, maybe you would need to better specify what you mean with spirituality.
Yeah.
But maybe you have done so outside these slides. I don't know.
Well, yes, outside these slides I have, but I think also in this research, I understand it is from the medical history, how much you ask the patient, whether spiritual history taking is something that is noted. And it includes their noting down their religious background or their spiritual background from the patient, and whether they like to have support during their hospital stay.
Okay, thank you. There is a further question.
Hi.
Yeah. Hi.
I think so.
Yes, yes.
Yes, yes. Hi, thank you for your talk. I would almost say thank you for advocating holistic approaches in our medical world. I'm from mental health, so that's no different, but very interested in competence of healthcare professionals. And did I hear correctly that you said that students report that they feel less inclined to address spiritual issues because it is not in the curriculum? Or did I understood you?
Yes.
Yes, okay. That I thought was very interesting. So there comes a bias with the medical student that, okay, I'm not allowed to. This is not what I'm taught, so I can't do that.
No, it wasn't that I'm not allowed to. It is that I do not have the necessary skills to be quoting exactly. What she meant was that I asked them what is their religious background, but then I don't know what is the next question I need to ask. So they do not have a guideline that they can follow when they are taking the spiritual history taking.